Hi, my name is Lindsey, and today I'm going to be presenting the Association of Adolescent Obesity and Poor Mental Health. Adolescent obesity and mental health are two significant public health concerns. Rates of adolescent obesity have quadrupled since 1990, increasing from 2% to 8% in 2022. Additionally, rates of adolescent depression have more than doubled from 8.1% in 2009 to 20.1% in 2021 following the COVID-19 pandemic. Many studies highlight the relationship between obesity and poor mental health, but it remains unclear if this relationship is due to the physical state of having an elevated BMI or the psychosocial role of weight perception. Gaining further understanding of this relationship is essential to developing effective interventions. Therefore, our study's primary objective is to assess the association between BMI and mental health and the role of weight perception and demographic factors. We used the 2021 Youth Risk Behavior Surveillance System, which is a national survey of 9th to 12th grade U.S. students, to perform an observational study. To define obesity, we used BMI percentiles, with overweight being 85 to 95th percentile and obesity being 95th percentile and above. To determine weight perception, we used the question that asked, "How do you describe your weight?" Mental health was determined with the question, "During the past 30 days, how often was your mental health not good?" Using these variables, we determined population estimates, demographics, and rates of BMI, weight perception, and mental health groups. Results from our study found the highest rates of poor mental health to be among adolescents who identified as multiple ethnicity groups, white, or American Indian Alaska Native. They were also higher in females compared to males and age 16 to 18 compared to 12 to 15 as seen in Figure 1. Table 1 shows that adolescents with BMIs classified as overweight or obese had higher rates of poor mental health, as 34.4% and 32.89% respectively experienced this compared to 26.76% for the BMI of less than the 85th percentile. The odds ratios also found that they were 1.44 and 1.53 times more likely to experience poor mental health compared to those with a healthy weight. Adolescents who perceive themselves as obese, regardless of actual BMI, were significantly more likely to experience poor mental health, with those who had a BMI less than the 95th percentile being 1.95 times more likely, and those with a BMI greater than the 95th percentile being 1.8 times more likely. Those with obesity who did not perceive themselves to be overweight were 0.65 times less likely to experience poor mental health compared to those who had a healthy weight and their perception was congruent. When we controlled for race and ethnicity in Table 2, we found the multivariable additive effects of weight perception, sex, and age to play a significant role in mental health. Importantly, when we controlled for all these variables, Asian, Black, African American, and Hispanic Latino adolescents now have decreased odds ratios of experiencing poor mental health. Also notable, although not statistically significant, when controlling for weight and perception, sex and age, American Indians, Alaska Natives were still more likely to experience depression than white adolescents. Through our study, we can conclude that the association between BMI and poor mental health was significant. However, the association between weight perception and mental health was even stronger. Additionally, we found that the additive effects of ethnicity, race, sex, and age highlight the need for personalized interventions in addressing adolescent mental health. Based on what we found in our study, we recommend further education for adolescents regarding BMI and also about the role of weight perception. A better understanding of what is considered a healthy BMI, what BMI really is telling us, and how the perception of themselves contributes, this can play an important role in treatment for those who struggle with mental health in relation to obesity. Additionally, we believe that development of personalized treatment strategies that use culturally inclusive, sex-specific, and age-appropriate approaches is essential to optimizing therapeutic outcomes for adolescent mental health therapies. In the bottom corner, references are found. Thank you for your time.